Hello, and welcome to the David Todd Miller Podcast. I'm your host, David Todd Miller. This podcast is about fitness, nutrition, having a positive mindset, and how to optimize the human performance as well as the human experience. This podcast is also about developing a never say die attitude, living a life of positivity and passion, and most of all, having hope. Well, we have Dr. Mehdi with us today. He is a licensed dentist here in New York City. Very well experienced, very knowledgeable. Mehdi, introduce yourself to the audience.
Hello everybody, my name is Dr. Mehdi Aryan. I'm a general dentist here in New York City, located at 80 Park Ave. David is a great friend of mine, also my trainer, who I'm lucky to have known for the past 3 years, and I'm here today to discuss some things that overlap between general health and oral health.
Where did you go to school at?
So I grew up in Boston. I graduated from Tufts Dental School in Boston, Massachusetts. Then I moved to New York to do my residency here at Montefiore, and I've been practicing for about 7 years now in New York City. Yeah,
good chunk of time in the Big Apple.
Exactly.
So what all goes into the schooling of dentistry?
So typically you have to do 4 years of undergraduate. Most people do it in biology or pre-med, and then after that you apply to dental school, and that's another 4 years. And then you can go on from there, do either a general practice residency, which I did, or you can go on and specialize in different specialties in dentistry.
Okay, so it's very much like becoming an actual like a medical doctor.
Exactly, yeah, same. And in dental school, most of our courses overlap with the medical students. So,
okay, so you kind of get a little bit of interaction with.
Well, you are a doctor specialized in the mouth, so just like any other specialty in medicine, whether it be ophthalmologist, specialty in eyes, or cardiologist, specialists of the heart, dentists are trained as medical doctors, specialized in the oral cavity.
Okay.
Yeah.
So what are some things that people may not know about a dentist in general, or some things that you kind of learned over the past years that most people would say, "Oh, wow, really?"
That's a good question. Well, I think, as far as not knowing things about the dentist is one thing, but a lot of people don't really know much about the basics of oral health, and that's where I like to educate people. It's about the patient, it's not about me. So when people step in for the first time, I like to kind of, give them a crash course on the importance of oral health and being a doctor. You're doctor, and I believe in Latin means to teacher.
Okay.
So I have to teach people about their current status of their oral health, and from there I can help them with some good understanding move forward with their needs and their treatment. So my primary goal, even before I start to do any dentistry, is to educate people, because once you understand the etiology of gum disease, or how cavities start, and how it affects your general health, then when you do take care of when you do your part at home with your home care, now you understand why you're doing what you're doing. You understand why it's important to floss. You understand why it's important to go for your routine checkups. And when you understand that, you're more likely to be on top of everything, basically.
Okay. So, just from everything I remember kind of growing up, you kind of learn it from your folks. You might learn it from, I had like a dentist come in school at like 4th grade or something, showed us how to floss and whatnot. But maybe like a commercial or something here and there, but you really don't learn a whole lot, I feel, as a general population, grade
Exactly.
school, high school, college,
Exactly.
all you hear is, twice a day, floss, and that's kind of where they leave you.
Exactly.
Where would you say people can kind of bridge the gap between what you know and what are good resources or something along those lines?
Well, most importantly is your dentist job to educate you. So that's where I set myself apart from a lot of other dentists who just kind of dive right into doing the work and not really taking the time to explain to the patient. But just like anything else, there's plenty of online, YouTube. Basically, any kind of information you want to learn is now at your disposal, and you can go online. But really, until you go to a dentist and you are informed about the different things going on in your mouth. You got to take X-rays. You don't really know what's going on. So first good step is to show up at the dentist. Make sure you're going for your at least every 6 month checkup, cleaning.
Why every 6 months?
So a lot can happen in a couple of months. If you go once every year, if a small cavity could turn into a big cavity in a year. So 6 months is a good amount of time, because if you catch things early enough, you can kind of nick them in the butt and take care of it, and that's really the reason.
Okay.
Yeah.
What exactly, from a medical standpoint, is a cavity?
So cavity is when the dental decay process begins, where bacteria feed on sugars. There's different kinds of bacteria in the mouth, but for instance, for a cavity, it is the bacteria feeding on sugar and carbohydrates in your mouth, and basically their waste product is acid, and acid is what starts eroding healthy enamel and tooth structure.
Gotcha.
So that's essentially what a cavity is, and basically the bacteria start to take over the tooth, and with time they just multiply, and the cavity grows and grows and basically rots the healthy tooth structure. So that's what a cavity is.
Okay. And so when you brush your teeth, is that neutralizing the acid or just removing the bacteria in general, or
Good question.
maybe both?
Yeah, definitely. Basically, brushing, toothpaste has fluoride in it. Fluoride is an anti-cavity agent. Basically, it reverses the tooth decay process, so it remineralizes enamel at its early stages. And yeah, you're basically wiping the bacteria off your teeth. But it is crucial, like we said earlier, to also make sure you floss, because a lot of the plaque and a lot of the food debris that's in our mouth is caught in between the teeth, and brushing doesn't really clean that. So when you don't floss, you're really not cleaning about 40% of the tooth surface. So
It's quite a bit.
Yeah, that's like almost like not brushing half your teeth. So that. And on top of that, when you don't floss, your gums are constantly in a more inflamed status, basically, and chronic. That becomes if that's a chronic condition, that turns into gum disease. So first, you start with gingivitis, which just means inflammation of the gums, and then over time, gingivitis turns into periodontitis, which is now not only are your gums inflamed, now you're losing bone underneath the gums, and also the gums start to recede. And so so gingivitis, I know people hear that term all the time in toothpaste commercials and things like that.
There are heavy hitters on it.
Yeah, but most people probably don't even know what gingivitis means, So yeah, that just means inflamed gums. But if you don't take care of that, then it turns into gum disease, and then you could have a lot more issues. You could lose teeth from gum disease. So
what exactly is causing the inflammation? Is it just a reaction to the acid?
no, well, that's a different kind of bacteria that we talked about with cavities. So there's all these different kinds of bacteria that live in our mouth. Some are responsible for irritating the gums, some are responsible for causing tooth decay. So when you have plaque accumulation below the gums, those bacteria that are specific to causing gum issues, they thrive and they multiply. And yes, their waste product erodes the bone structure, of the jaw. Our teeth are anchored in bone. So with that, the bone level starts to be depleted. And, if that goes on for many years, the teeth start to get loose because the teeth are anchored in the jaw inside of bone. So,
No bueno.
yeah, and these are things that, unless you're a dentist or your dentist educates you on it, you're not really going to know. So this is why I have these discussions with patients so they understand. And once you understand, that's the first step of, tackling the problem, basically.
Okay. So I mean, I got like 4 questions out of what you just said. I'll start with kind of the simpler one and maybe graduate up from there. So flossing, you said, is a big one. 40% is being hit when you floss, so you're getting the whole 100 roughly, more or less. There's different ways to floss. You got like you have kind of like the little picks. It might be an inch wide or so.
Mm-hmm.
You have the regular floss that you get at the dentist, kind of the long cord, the water pick.
Mm-hmm.
Are there any others, and which one is the most effective?
That's a great question because, I see a lot of people come in with they're like, yeah, I use the picks, I'm really on top of it, but then they still have cavities, they still have inflamed gums. It's certainly better than doing nothing, but, that's another thing. I take my time and give them oral hygiene instructions, show them how to properly floss. So the best kind of floss is to use the tape floss,
kind of
like Oral-B Glide, for example.
Okay.
The regular, strand of floss, a lot of times it gets thready and it's annoying. I recommend Oral-B Glide to patients because it literally glides in between the teeth. It doesn't get thready. And, what you have to do is not only go in between the teeth. So the reason why the picks are no good is because when you hold, and it's hard for me to explain this on a audio interview, but it's kind of a visual thing. But when you floss, you want to make sure you're scraping that in-between surface of the tooth. So with the picks, you're just simply going in and out, in and out. You don't have that...
almost like a friction. You
don't have the dexterity, to, like when you hold a strand of floss, you're holding it with your 2 hands. So you can kind of drag it up against that in-between surface, and that's the whole point of flossing, is to scrape that in-between surface.
Gotcha.
So when you use the picks, you're simply just going in, out, and you're not really scraping the in-between surface. So, you might be missing a lot of the plaque and food debris that's still there.
Okay.
Water pick is good, but I always tell people use it in conjunction with your regular floss. Don't really replace flossing with water pick, especially for people who have fixed retainers after getting ortho and things like that. Water pick is a good tool because you can't go in between the teeth. But,
okay.
You want to make sure you use the conventional floss, and you kind of have to, kind of like a C shape. You got to drag it up against, that in-between surface of the tooth.
Okay.
Rather than, with the picks, like I said, you're simply just going, in and out in that in-between space, and it's not as efficient.
It doesn't matter if it's waxed or non-waxed, is that?
The tape floss is not waxed. It's kind of the matter of personal preference, but like I said, I found that with the Oral-B Glide, that's the easiest way to get in and out in between the teeth. So that's the one I recommend.
Okay, so we got brushing your teeth, we got flossing.
Mm-hmm.
Mouthwash is a big one. They're always talking about prevention of gingivitis, like you mentioned earlier, and is that something that is really going to make a difference, or is that just kind of advertisement?
It can hurt, but all you really need to do is brush, floss, and go, for your routine checkup and cleanings, and all that other fancy stuff is kind of extra. you can certainly use mouthwash, but at the end of the day, it just comes down to brushing and flossing with the right technique.
Okay.
Yeah.
So I know for some people they're not too worried about like the mouthwash, with their teeth and their gums. They're like, I got good teeth, good gums, but I got bad breath. So I'll ask you two questions from there. So there's some people who just use it for that. Is that something that is really going to help, or is that a temporary fix?
A lot of times people have bad breath because they might have some gastrointestinal issue that they haven't addressed. If they don't have gum disease or they don't have rotten teeth, that's something to look at. Also, brushing your tongue is an important one because the tongue has a lot of tiny filaments that harbor bacteria too. So it's important to definitely brush your tongue because it can build up a thick film of bacteria because of those tiny filaments. So it's important to also incorporate tongue brushing, or you can use a tongue scraper, things like that.
Okay.
Yeah.
It doesn't matter. I remember. I think I've heard this once. I don't know if it was a dentist or somebody else or what. But when you are scraping the tongue or brushing, you want to try and get more of the back of it. Almost to the point that you got that thing down your throat.
Yeah.
Is that true or
well?
Overkill?
There are different types of filaments in the tongue. So perhaps in the back of the tongue, there are more porous filaments. So yeah, it makes sense. You want to make sure you get back there and you scrape off all that bacteria from the more porous part of the tongue.
Okay.
Yeah.
Is there anything dietary wise or maybe even just hydration that will reduce the buildup of that bacteria? I don't know how fast it builds.
So there are people who have different content of saliva. Some people don't create as much saliva. Some people just have a more acidic pH of the mouth, and these are things that the dentist can definitely look into for the patient. And there are people who have like Sjorgen syndrome, or people on medications that dry the mouth, and those kinds of patients have to be more aware of that, because saliva has a lot of antimicrobial properties, and if you just don't even have enough saliva production, you could be more prone to cavities, because saliva actually helps fight cavities. So some people who are, let's say, mouth breathers, they have dry mouth overnight, and they could be more prone to getting cavities, for example. So
Gotcha.
that's why like I said, it's really important to educate people, because there's a lot that goes into it, and you have to make sure your practitioner is kind of taking a comprehensive look at everything, because if you're just focused in on one tooth and not looking at the general picture, a lot can be missed. So you want to make sure your dentist is on top of it all, basically. So
you threw out a word there I've never heard. It's like Sjorgen
syndrome. It's spelled SJORGN. Yeah, and that's kind of like a autoimmune disease, and a lot of times the patients they don't produce enough saliva. So there are medications, there are rinses, there are chewables that can stimulate saliva production.
Like saliva glands.
Exactly. So this disease is actually triggers your salivary glands. Exactly. So this is saliva is big. Saliva, the content of the saliva. Some people may even have enough saliva production, but we can check the pH of the saliva and just make sure the mouth is not in a acidic kind of environment, because acid is basically the tooth's number one enemy. So
if you have a good amount of hydration, is that going to be a large factor?
That definitely helps. Exactly. So people with dry mouth and these sorts of conditions that cause dry mouth, one main thing is is keep drinking water. You know, stay hydrated. You know, that's definitely one of the recommendations that we make. And you know, just as far as your general health goes, you know, that you're always telling me, you know, you gotta drink your 8 cups of water at least per day, and just for the homeostasis of our body, you know, you have to be hydrated, and water is essential, you know, not just for your oral health, but for your general health.
So we're brushing our teeth, we're flossing, we're making sure we're hydrated, cleaning our tongue, and we're staying away from sugars because that's making the acid. What about like salt? Does that have any effect?
No.
No? There's nothing else we really need to watch out for? Like
just sugar, acid, you know,
so like soda,
energy
like
drinks, soda, Gatorade, you know, just anything sugary, juices. You know, people think juice is good for you, but really all juice, most juice is just sugar.
Yeah.
So, you know, these are things you have to educate your patients about.
So what about like stains and stuff like that? You know, coffee stains, wine. What's going on there? Is it really
just the pigmentation from the wine or the tea?
It's just
stains the coffee. Yeah, just sticks to the enamel. Yeah, so the dentist can just polish that off. Yeah.
Is that something, you know, if you're trying to be as preemptive as you can, do you want to have your coffee and then brush your teeth, or brush your teeth to prevent the coffee from staying on?
Well, staining doesn't damage your teeth. It's more of an aesthetic thing, you know. And usually when you drink coffee, the stains are in the back surfaces of the teeth. So, you know, just when you go for your dental cleaning, the dentist has the right tools, or the hygienist, to scrape those stains off, so that's not a big deal. Okay. Yeah.
So I know, like, you can go to the dentist and you can get whitening and stuff like that. What about like the over-the-counter, so to speak, like the Crest whitening strips?
You know, those things help, but you know, the one at the dental office is kind of prescription grade. So if you want, you know, real noticeable changes, then you get in-office whitening. But you know, those products over the counter definitely work. You know, they work differently for different people, but you know, as long as you don't, the one thing with whitening that people need to realize is your teeth and gums have to be in good health. You know, if you haven't had a cleaning for a long time and you want to go get whitening, you're gonna damage your teeth and your gums by putting that on a dirty surface. So first thing is to get the mouth in good shape, take care of any cavities, get rid of the plaque buildup, and then once everything is in good shape, you can do whitening. Okay. To get the best results.
Okay. So let's I'll throw out a curveball. So let's say I walk out the door, I trip on my shoelace, I knock my tooth out. What do I do? If you know,
you gotta phone the dentist ASAP. But in the meantime, depends. If a lot of times, you know, you can put your tooth in milk, or in it's called Hank's solution. Well, not everyone is going to have that lying around, but this is what they teach you in dental school.
Okay. Hank's solution. Yeah. Where do I just get that at Walgreens?
Like, I think at a hardware store or something, but you know, usually in a cup of milk is good. And
do I want to put milk in my mouth and try and save that part as well?
You take a cup and you put it in, and you just contact your dentist right away. It depends. If the tooth comes out in whole, there's different approaches that we, you know, I don't want to get into that right now because there's a whole list of them. Okay. Whether the tooth is avulsed or it's luxated or if it's fractured.
Depends on the trauma, so to speak.
Depends on the trauma. So, but yeah, you need to call the dentist ASAP and take care of that.
Okay. Yeah. So I'll throw out another curveball. So what happens if?
Why all the curveballs?
see how well you can hit them.
Okay.
So let's say that occurs, and for some reason, you know, it happens in the middle of the night. You know, I'm walking around, I run into something and knock the tooth out. I put it in. How long is that good for? Or like, is there anything I could do?
For a couple hours, but honestly, you know, if something like that happens, you know, there are, even in emergency rooms, they always have a dentist on call. You know, it's better.
Like a hospital?
Yeah. Okay. It's better to take care of it ASAP, because with those kinds of problems, the sooner you address it, the better it is.
Okay.
And definitely contact your dentist, and they would get back to you in their, as soon as they open the office. But if you can't, they do offer dental emergency services in hospitals, emergency rooms.
Did not know that.
Yeah.
I would have been like, crap, the dentist is asleep right now. I got to
I
hold on
used
to this
to,
too.
in my residency, I worked in the hospital, and we had to do call every couple of nights, and people come in at 3 in the morning with a tooth abscess, and you have to do incision and drainage.
A lot of hockey players.
No, just a lot of people who neglected their teeth until it started acting up one day at 3 a.m. Mostly, yeah.
So if someone chips a tooth, or they crack it in half, how do you guys put it back on? Like, how it's important to save it. You guys are actually reattaching the tooth more or less.
Like I said, depends on the case. Sometimes we can use bonding agent to bond that piece of tooth to.
Is it like a glue, or is it like a calcium kind of thing?
No, it is a bonding agent. It is like a glue, but it's meant for your teeth. It's not like Gorilla Crazy Glue, but but a lot of the time we use our restorative material. Depends on the amount of the size of the crack. If it's a big crack, then the tooth might need a root canal, a post, and a crown. If it's a small, we have to see if we can use that piece of tooth to bond it back. Sometimes we have to use our resin material, composite material. So it's very much based on case to case, on a case to case basis. So I don't want to just throw something out there, because every case is different, basically.
So if it's just kind of like, I'm assuming that like if it's the edge and you reattach it, it's okay. At what point does the tooth, because it's bonded by this resin or this bonding agent, does it say we're not going to accept this?
So
and the tooth dies?
If it's over 40% of the tooth's surface, then most likely the tooth is going to need a full coverage restoration, like a crown.
Gotcha.
Because if you just use some composite material with bonding, most likely if the patient bites into something or chews on something hard, it's going to break off. Yeah. So you want
no jawbreakers.
That's going to be more substantial, like a full coverage restoration, such as a crown.
Okay. So kind of backtracking a little bit. So we were talking about sugar. Sugar is no good. Mm-hmm. I have bright fluorescent green branched chain amino acids over there, green apple flavored. Okay. But it's sweetened with sucralose, I believe, which is, it's not sugar.
It's alcohol.
Yeah.
Yeah, so actually, a lot of sugar alcohols are actually good for your teeth. So this one, I would have to look it up.
It's like Splenda, actually.
Okay. Yeah, that's not really, that's not bad for your teeth.
Okay.
Yeah, and even like if you chew gum with xylitol, which is a sugar, alcohol, kind of like in Trident or in Orbit. You don't want to chew, for example, juicy fruit. That's got a lot of sugar in it. Yeah. But there are certain gums that actually help fight cavities. Okay. So like Trident, choose Trident.
Trident white, Trident,
doesn't matter what kind.
We're just looking
for any kind of chewing gum with xylitol is actually good for your teeth. Yeah.
Okay. Are there any other sugar alcohols that we should watch out for, or any other gums that have something else in it?
No, it's basically just xylitol.
Okay.
Yeah.
So is it possible to stimulate whitening with the gum like they advertise, or is it more of?
It's not going to be substantial, it's going to be very minor, but that's more of a marketing gimmick.
Okay.
It might do like 5%, if that. But yeah, if you really want some decent results, there's better options than chewing Trident white.
Okay.
Yeah.
So maybe something just kind of have, from time to time. It's not going to hurt you.
Yeah.
Sounds good.
People tend to underestimate the overall effect of or importance of oral health, because your mouth And your oral cavity is, first of all, it's where, you take in all the food and everything like that. And, when you don't have healthy teeth and healthy gums, it really does. For example, this is another great point to tell our listeners is people who have gum disease are much more prone to getting endocarditis and heart problems. I've seen, someone with a gum abscess in the emergency room who actually went into shock because, the their endocardium, the inner encasement of the heart, the bacteria that infects that is the same bacteria that we find in our gums. So there is no gate that separates your oral cavity from the rest of your body. And I've seen people who they think they're in great health. They go to the gym, they exercise, but then they neglect the dentist, and then they have issues. And that person is not really healthy because they may go to the gym and they may,
work the muscles and everything.
Exactly, but if you want to be in tip-top form, you got to really be on top of your oral health because it's like a domino effect. If you neglect that, you're going to open up a big can of worms. So it's pretty simple. It's just like, as a trainer, you tell us, me included, stay on top of it. It's about consistency.
Yep.
Same thing with oral health. If you want to keep your teeth for a long time till the day that you leave this world, you gotta do your part at home. That's the most important part, more so than going to the dentist. That's important. So we can take x-rays, so we can clean the teeth, but it's really what you do at home every day and being consistent with it and not just flossing once in a blue moon or once in a week and, developing those habits and sticking with them, just because when you develop the habit and you get into a routine, then, it's much easier than if you just kind of like exactly with working out. You don't work out for 3 weeks and you go back and work out one day. What good is that? You might as well not even do it. So It's same thing.
So keeping up that consistency, how consistent? I mean, you want to try and do it every day, twice a day.
Yeah.
Do you want to go as far as like after every meal?
If you want to definitely try to brush twice a day. I know ideally you want to also floss twice a day, but if you floss once a day, that's good enough.
Okay. Is there any benefit to doing it in the morning as opposed to the evening?
Probably
vice versa?
evening because, like I said, when we go to bed, depending on, especially if a lot of people, are mouth breathers, things like that, and, the mouth is much drier at nighttime, and like we discussed, saliva has a lot of antimicrobial properties. So, you want to make sure you definitely do it before bedtime. And I always tell people floss before you brush. That way you remove anything in between the teeth so the foam from the toothpaste can
That is something I
penetrate.
had not heard before. Floss first, then brush.
Yeah, because now the in-between surfaces are cleaner and more open, so the foam from the toothpaste can get in there better and do its thing and do its job and clean everything up.
Okay.
Make sense?
It does.
Okay.
I remember my question. So
That was your question?
No, this is my question.
Okay.
So there are your typical, your Crest, your Aquafresh, and that kind of thing, and then there's I actually use a natural toothpaste because the other ones, from what I understand, have some chemicals in it. Might not be as good for you.
You use like Tom's?
I use Tom's.
Okay.
I don't know if it's flavored or what, but I made sure that it had fluoride.
Yeah.
But what chemicals are in the other ones that might not be as good for you, or what should the listeners be looking for? If they pick up a toothpaste that has active ingredients, inactive?
Honestly, more or less they're all the same. Some of the holistic ones get rid of fluoride. Fluoride is really important in nicking cavities in the very early stages in the butt. Like I explained earlier, they have that property to remineralize enamel when the tooth decay is super tiny. So honestly, when people ask me about brands of toothpaste, things like that, they're all pretty much the same. They have fluoride, they have some sort of abrasive, to polish the surface of the tooth. It's not really about the brand. It's not about the, brand of toothbrush. Just make sure it's a soft bristle toothbrush so it's not abrasive to the gums. And it's really about the technique, the consistency, and how often you brush, floss. You can have the fanciest Peloton machine in your house, and it could be collecting dust. That doesn't mean you're gonna be fit. Or you could have a guy who has no equipment, but he's knocking out burpees and push-ups, and he's in tip-top shape. So there you go, perfect analogy.
Very true.
Yeah.
So toothbrush-wise, like I've always been told, you want to hit the teeth at a 45-degree angle.
Yeah. So
small circular motions.
Exactly. So listeners can look up BASS technique, BASS.
BASS.
Technique. That's the right technique, and you just described what a BASS technique is.
Okay.
At a 45-degree angle in small circular motions, with half the bristles on the gum, half on the teeth.
Okay.
And you want to make sure you spend about 4 minutes brushing. I tell people don't rush brush. I usually tell kids that because they think, they go boom, 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 boom. After 10 seconds, they tell their parents, oh, I brushed, I'm good.
I'm guilty of that. It's like at first thing in the morning, it's like, okay, I'm running late.
You want to take your time. I usually tell people,
4 minutes.
Put on a song that you like. The songs are usually about 4 to 5 minutes, so just brush from beginning to end, and that should be sufficient.
Okay, that's definitely a good one to know.
Yeah.
Toothbrush, I think it's my last question for you. So I have I think it's an Oral-B, and it's an electric one.
The Braun,
And not a Braun.
It's Oral-B Braun, I think.
And it's a circular head and just kind of goes back and forth.
Yeah. As far as that's
better
good. Like I said, even if you have the right technique with the manual toothbrush, but I really like the Philips Sonicare toothbrush because it uses the ultrasonic vibrations, and you basically just does the whole job for you. You just hold it up against your teeth, and the ultrasonic vibrations really break up that dental plaque.
Okay.
And
probably also simulate some blood flow to the gums too, right?
Yeah, perhaps.
Like a gentle massage.
It has different modes. One is for gum, one is for. So that one is a really good one. So especially for different people accumulate plaque at different rate. So for people who tend to build up a lot of plaque, I definitely recommend Philips Sonicare. And I have no affiliation with the company. It's just a really good brand. So yeah.
Okay. Well, Mehdi, I think that's all we have time for.
We covered all the bases.
I think we got a good start. I'd love to have you on again.
Thank you so much.
Thank you very much.
You're the man.
Right back at you.
All right. Thank you.
So again, Mehdi, if anyone wants to have you as their dentist or contact you for questions,
I would love to have them, and I'm there.
Where are you located at again?
I'm at 80 Park. That's on 39th and Park, right near Grand Central.
Okay, and the name of your business again is?
It's called Vita Dental.
And it's online as the
VitaDental.com. VITTA Dental.com.
And if anyone wants to check you out on social media, where can they find you at?
Vita Dental. Vita Dental and NYC, I believe.
For Facebook,
for Facebook,
Twitter,
Instagram. I don't think we do Twitter.
Not yet.
Yeah.
Okay.
You're pushing me to be more active on social media, and I appreciate that.
Any YouTube?
I have not, but definitely something I need to look into and follow in your footsteps. And
so if we have Mehdi on again, and if he has a YouTube at that time, we'll update you guys. But again, Mehdi's on Instagram, Facebook as Vita Dental NYC.
Yep.
And website as well, and then he's up near Grand Central for his place of occupation.
Yep. Thank you, Dave.
So very welcome. Very welcome.
I appreciate it, and thank you for having me.
Thank you for coming on.
Yeah, for sure. Anytime.
Awesome.
All right.
Well, until next time, take it easy.
Okay.
Thanks again, guys, for taking time out of your day to listen to the podcast. Also, thanks to Natural Machine Nutrition for sponsoring this podcast. If you're interested in natural supplements without fillers, dyes, chemicals, anything like that, check out Natural Machine Nutrition at naturalmachinenutrition.com. And if you would like to contact me for any reason for podcast ideas, people who you'd like to hear interviews from, anything like that, go ahead and send me an email at info@davidtoddmiller.com. Also, open to constructive criticism. Would really appreciate it. Always trying to do my best to help you guys out. You can also find more content at davidtoddmiller.com. I have workout videos, nutrition videos, some cookbook recipes, behind the scenes of any kind of fitness modeling or anything like that I've done. And if you're interested in personal training or nutrition, you can reach me at wallstreettrainer@gmail.com, or you can go ahead and schedule a free consultation on the website. If you're not located here in New York City and looking for a one-on-one semi-private class for personal training, you can still reach out to me and I can put together an online program for you going over the details for workouts and or nutrition, and we can pretty much just correspond via a mobile application that you can download right on your phone. So that's another possibility as well. Again, thank you guys. Sincerely appreciate your time. Go out there, have fun, enjoy every moment life has to offer, live your passion, help others, and most of all, have hope. This is David Miller, out.